The date today is January 13, 2014. The time is 5:30 p.m. This is the meeting of the Paris City Council. I'm going to call the meeting to order. As usual, we will start with invocation to be led by Pastor Aldridge, followed by the Pledge of Allegiance by Dr. Grossnickel. If I can ask everyone to please stand.
Let us pray together. Gracious Heavenly Father, we pause on the front end of this meeting and ask, as you invite us to do, for your wisdom. As the Bible says, we lack wisdom and we ask that you graciously give. And so I just ask for that, for these men and women. I thank you for them and for their service. I thank you for their commitment to our city. And I pray that as they discuss and debate tonight, and as they look to the future, I pray that they would do so, Lord, with your wisdom and with the best interest of the city and no personal agendas. And we thank you for their unselfishness in that. And we just commit the night to you in the name of Christ and for your glory. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next slide up. Item number 4 is the Citizens Forum. Persons desiring to address the council must limit their presentation to no more than 2 minutes. Unless an item is posted on the agenda, the Texas Open Meetings Act prohibits the council from responding to any comments other than to refer the matter to a future agenda, to an existing policy, or to a staff person with specific factual information. Claims against the city, council members or employees, as well as individual personnel appeals, are not appropriate for the Citizens Forum. The Citizens Forum is now open. If anyone wants to speak, please come to the podium and sign your name and address for the record.
Good afternoon, everyone. My name is Johnny Lee. I reside at 2306 Simpson, Paris, Texas. Today I'm here on behalf of a program that supports a great number of people from Paris, and it happens to be A&M University in Commerce. And each year they have a small business and entrepreneurs conference. And in the past, historically, we have, through the Paris Economic Development Corporation and the Red River Regional Business Incubator, supported that conference. Unfortunately, the decision have been made that have affected our city supporting that program this year, that conference. And so I'm only here to make everyone aware because it was essentially a budget item for the council to consider many months ago, and that we will be, if we cannot find our way clear to support this conference in a small way, meaning financially, we'll not have, number one, our presence there, and we've always had a big presence and an ongoing presence with them. There's a number of us from Paris that are active with them in planning this as volunteers. And it's not a lot of money, but it's occurring in a short period of time, in about 4 or 5 weeks. I have the last proposed agenda, and I have a copy of last year's program, and I would just like to see Paris recognized as a supporter of A&M in Commerce and the Small Business and Entrepreneurship School that they do, where they do such good work. Thank you all very much.
Thank you. If you could talk to me after the meeting, please.
My pleasure, Mayor.
Thank you.
Thank you very much.
There are seats up front if you want to come and sit down. If there's anybody else wants to address the council.
Yes, Dr. McLemore, I'd like to address the council regarding the Center for Disease Control's new high recommendations for cities regarding exposure to cigarette smoke. It's been known for many years that cigarette smoke causes lung cancer in smokers. But now there are a number of studies out there that show that cigarette smoke not only affects smokers, but passive smokers or individuals exposed to secondhand smoke. And I'll give you a few examples to be brief. First of all, lung cancer is the #1 cancer killer in adults in the U.S. today and smokers. 443,000 individuals each year die from lung cancer, but 53,000 of those are non-smokers who are exposed to secondhand smoke. There are also a number of non-malignant diseases such as COPD, which are caused by not only smoking, but exposure to secondhand smoke. And the World Health Organization has actually issued a guidelines now that will say that by the year 2030, chronic obstructive pulmonary disease will be the #1 killer in the world of adults, surpassing lung cancer and other diseases. And many of those individuals are dying from exposure to secondhand smoke who are true non-smokers. There are also many concerns now regarding asthma. Asthma death rates have increased in the U.S. and worldwide, and we know now that cigarette smoke is a big trigger for asthma, not only in adults, but in children. And we know now that many children are affected tremendously with regard to asthma, and that many children, as well as adults and young individuals, are dying each year because of asthma. And we know now that not only does cigarette smoke trigger asthma, but just smelling the smoke itself on hair and on clothes greatly affects individuals with regard to asthma. There are also a number of non-pulmonary diseases such as coronary artery disease, atherosclerotic disease, and cerebral vascular disease that are increased in patients and individuals exposed to passive smoke. Also, a number of non-pulmonary malignancies such as kidney cancer, GI cancers, and head and neck cancers have been associated with passive exposure to cigarette smoke. The CDC has therefore issued a strong recommendation to all cities nationwide that we ban cigarette smoking from private workplaces, restaurants, and bars. And I'm here today to strongly recommend this. And remember, cigarette smoking, we thought, only harmed those who smoked. But now we know it harms many individuals who don't smoke. And we need to follow the guidelines for the CDC, and I strongly recommend this. And we have a number of young people here today who want to support this. And I'm going to let the teachers introduce them now, if it's okay with the board,
Sure,
with the
go ahead.
council.
That's fine.
Thank you.
Good evening. Good evening. I'm Deb Fleming, and I'm a teacher at Crockett Intermediate School with Paris Independent School Districts, and my children are dedicated on a community service project.
Tobacco, death, and disease. In Texas, tobacco use is the single greatest preventable cause of premature death and disease. Tobacco use is a major risk factor for multiple cancers, heart disease, stroke, and lung disease. Cigarette smoke has over 599 ingredients that, when burned, ignite over 4,000 dangerous chemicals, over 50 of which are known to cause cancer. Approximately 24,000 adults die of a smoking-attributable illness annually in Texas. That is more than die from AIDS, heroin, cocaine, alcohol, car accidents, fire, and murder combined. For every one person who dies from a tobacco-related causes, there are 20 more people who are suffering with at least one serious illness from smoking. 400,000 smokers die each year. 50,000 non-smokers die each year. 1,200 people lose their lives today because of tobacco. That's one person every 72 seconds.
We took a survey at...
Your name?
Oh. Hi, my name is Autumn Rose. We took a survey at Crockett Intermediate School and at Holiday in Paris. Holiday in Paris adults, which we surveyed 137 people, and Crockett students, we surveyed 478 students. Here's one of the questions from the survey. When you or your family goes out to eat in our community, do you prefer to eat at a restaurant that is a non-smoking facility? Holiday in Paris adults answered yes, 94%, and Crockett students answered yes, 93%. Here's another one. Are you concerned about secondhand smoke for you and others? Holiday in Paris adults said yes, 94%, and students at Crockett said yes, 93%. Overall, our surveys show our citizens want to eat out in a non-smoking facility for their health.
Thank you.
Hello, my name is James Miller. Did you know 15.5 million kids in the U.S. are exposed to secondhand smoke in the home? And by the way, secondhand smoke contains all the same harmful chemicals as the smoke from the cigarette. Also, the University of Minnesota found that the ventilation systems and designated smoking sections do not protect patrons from secondhand smoke. Waiters and waitresses who work in a smoke-filled restaurant or bar inhale enough secondhand smoke to smoke 2 packs during an 8-hour shift. And most importantly, 1 in 3 youth smokers will eventually die from a tobacco-related disease. Thank you.
Thank you very much. Thank you all for coming.
Mayor Hoshmi, I would just like to say I have met with this group over at Crockett, and Ms. Fleming has done an excellent job with these students in finding this research, and they have been very excited about coming before the council, and I just want to say what a great job they did.
Thank you very much for coming. Anybody else wanting to speak? Dr. Green?
Hi, I'm Amanda Green. I just wanted to follow up what Dr. McLemore and the students said. The reason we wanted to present this to the council today is to request that the council please direct the city staff to make a stronger public smoking ordinance for Paris. We do have packets that we've prepared for y'all that has an ideal smoking ordinance, and we'll distribute those if the council could please consider that for future meetings. Thank you.
Thank you very much, Dr. Green.
Connie Stouter. I'm with the Paris-Lamar County Health Department. Somebody has to follow the kids, so I got it. But one of the things I would like to invite the City Council, if you can remember last spring, I think it was, we came and talked to you about perhaps a citywide bus route in the city of Paris. And I am pleased to say, even though the wheels turn slowly, maybe a pun, but anyway, there is going to be a Paris City Bus Workshop. It's going to be held on January the 22nd at 2 o'clock, and I'll pass out a flyer to you. It's going to be held at Paris Regional Hospital South Campus in the cafeteria there, and it's open to the public. It's open to the city manager, the city staff, and I would certainly urge any of the city council members that could attend to please come. They really want our input onto what kind of a bus route system we would like to have in the community, and we know that there's a big need for transportation in our community, especially with the seniors and those with low income and those with disabilities. And this would be a great opportunity for everyone to have some input on that. So I again urge you to do that. And the second item I'd like to mention to you has to do with beginning a new year and perhaps having a few New Year's resolutions. And I know this doesn't apply to the city council, but some of us would like to lose a few pounds, and we have a program that started called Lighten Up East Texas, and it's a weight loss challenge. It started in Tyler, actually between I believe the manager of the local newspaper there and I believe the mayor of Tyler, challenging each other to lose weight, and from there it grew. Moved it from East. I'm not talking about anybody. That's y'all's personal. I'm in trouble now. But anyway,
All right, I'll be there, Connie.
But anyway, if you are interested in being a part of this weight loss challenge, we are now signing people up, and you can weigh in. The challenge goes all the way through May the 31st. What's really neat is you have an opportunity to get your name in the hopper to win a new car. And the lady that won last year had lost 15 pounds. She had one ticket in the drawing, and she won a new car. So it's not about the amount of weight you lost. It's about getting started and getting on a healthier road. So I'd just like to invite you to participate in that.
Thank you.
Do you sign up at the health department?
You can, and there are 5 places that the public can sign up for: CrossFit, Dare to Be Fit, Paris Fitness and Aquatics, the health department, and Prime Time. So you can go there. They have your little registration cards, and you can weigh and get started on being healthier.
Dr. Grossnickel, are you going? I'll come along.
Yes.
I knew I was going to be in trouble when I wrote.
Oh, you don't know trouble yet. Anybody else wanting to address the council? If there's nobody else wanting to address the council, I have some very exciting announcement today. And the announcement is about Lake Crook project. Dr. and Mrs. Swint are here today to make a generous donation in the amount of $100,000 to go towards the rejuvenation of the Lake Crook Park. They're both here with us tonight, and I'd like both of them to please come up to the podium. And on behalf of the City Council, the city employees, and the residents of Paris, I want to tell them how much we appreciate your donation and thank you for investing in the community. Please come up to the podium. I'd also like the council to come down to the stage.
I am Richard Swint, 2510 Stillhouse Road, Paris, Texas. This is my wife, Susan. Lake Crook Park was a very special place in my childhood. Perhaps I'm the last of the generation who can remember the glorious period of Lake Crook Park. When I first moved back to Paris, I had a number of patients ask me about the preservation of Lake Crook Park that they used to come to as children from miles away. The park itself consists of about 3,000 acres, about 1,250 acres of which are in the lake. As best I can tell, the lake and the park is the largest in the state of Texas owned by a city. People in Paris do not recognize the value of this sleeping asset. Had the money that we put into the Paris Economic Development Corporation been put into this park, Paris would have notoriety that extended beyond Lamar County and to other states. A park like this is for young people. It has great potential to change the character of this county and this town. It should be preserved in its entirety and reserved for people to enjoy with its potential that it was initially intended to be. I want to read a statement by Mayor Crook that's a very telling thing. Remember, this park was established and developed within about 3 years of the disastrous fire of Paris. His statement was, "This park is for the people of this area, and it will change the people's attitude toward being here. And the building of it established jobs for many people in a critical era. They had a bond issue for $1 million, And this had to be a trying time, and it passed 10-1, people voting for it. You need to remember that this park was constructed and erected, the dam was erected, without any assistance from federal or state levels of government. It was built by the people of Paris, Texas. The interesting things that we run across, Mayor Crook was a really different type of person. He has a statement that he never did use any of the money that he was paid to be mayor. He either gave it to people or to the city. He became mayor first in 1920. No, not first, but he became mayor in 1920, perhaps for the second time. And he brought about the construction of the lake starting in about 1922, and it was finished in about 1923. An interesting thing to me is that lights were turned on in the park in June of 1931, which was a remarkable achievement. And in his comments about that, that was associated with the municipal band concert. There were many concerts held actually in Lake Crook Park. The grounds were mowed, they were irrigated and watered, and their upkeep, and we recently read an account of a lady going and describing in her childhood the flower gardens that were at the park. There was a pavilion and a dance floor that was on a high bluff overlooking the lake, very picturesque. There were picnic areas the entire circumference of the lake with permanent concrete built facilities of tables and barbecue pits, and it was all well kept and groomed. An important asset of this park is that we have a raw water supply available to make this park be entirely irrigated and to be something that would be unique for the state of Texas. So it is with great pleasure that I'm able to present this donation to start a fund for reestablishment and restoration of this park. I've been nervously holding this check. I'm going to present it to my wife to present it to you because it didn't bother her at all to write it and sign it.
Any of the council members want to make any comments? Ms. Drake?
I do remember, unfortunately, things like he was describing, and I'm very excited to hopefully see this be restored back, and just thank you from the bottom of my heart and from the citizens of Paris for your generous donation.
Mr. Price?
Sure. To both of you, thank you so much. What a wonderful thing to do, to be able to give back to your community, and something we should all strive for. So what a wonderful gesture, and thank you both very much.
Dr. Grossnickel?
Yes, Mr. Miswint, Dr. Miswint, thank you so much. It's a wonderful donation to a worthy cause, and while this came out of left field, as far as I knew, you know, they spent a lot of time thinking up possible projects and amendments that can be made to the park. Gave a lot of thought in it, and that hope we'll be able to implement many of your good ideas. Thank you again so much.
Ms. Lancaster.
This is a great gesture in improving our city, and I hope it's going to spark other people to think how they may aid in bringing Paris back to what it once was, and I'm just very excited to see what develops out there. Thank you.
Mr. Jenkins.
Pretty well the same. I thank you, Mr. Swint and Mr. Swint, for the donation, and I'd like to get out there and see how it is. I know a lot of people talked about it back in the day, so hopefully I can get to see a few things.
Mr. Wright.
Thank you, Doctor and Ms. Swint, for such a generous gift. I hope someday people will remember your gift just as you remember the deeds of Mayor Crook. Thank you.
And I want to thank you too, and I want to add to that that I would like to give a personal donation of $10,000 to the same account. All right, moving right on. Jenny, is anything left on this? No, right? Okay. Next, we move on to the consent agenda. Any of the council members have any questions on the consent agenda? So in the interest of time, can I have a motion on this?
I make a motion, we approve the consent agenda. Excuse me.
All in favor? Seconded by Ms. Lancaster.
Aye.
Anyone opposed? No, the motion carries. We next move on to the regular agenda. The regular agenda starts with item number 12, which is receive presentation from senior staff members of a regulatory agency for Affordable Healthcare Act. I want to thank a couple of people in this regard. First of all, I want to thank Congresswoman Eddie Bernice Johnson, who has a nursing background, and I think this topic is dear to her, and I want to thank her from the bottom of my heart to have arranged all of this for us for education of our citizens and residents. And I think Rod is here from Ms. Johnson's office, so if you can please stand. Thank you. Thank you for coming. The presentation has a number of things in it, but we will start with Ms. Marjorie Petty. Ms. Petty is the Regional Director for the Department of Health and Human Services, and I want to welcome her to Paris and to the City Council. Please come. I want to say one other thing. This is not a question and answer session. This is just a presentation, and that's what we'll limit it to.
Mayor and City Council, it's a privilege to be with you all tonight. It brings back great memories, actually. I previously served on a city council some years ago, and I know that being mayor and being on the city council is a challenge. It's an incredible opportunity to serve your community. And I do recall feeling that really this is a perfect example of what really is important about this country. The towns that have commitment on the part of the community, and that you feel a whole room full of people that actually are here because they're invested in the goodness and the good work of the community. So it's a great opportunity to be back in a forum like this. My first trip to Paris, I have a very dear childhood friend that grew up here, but it's my first time here, so it's a privilege to be here with you all. Well, thank you for the opportunity. My role is actually as the regional director. My territory is the 5 states in this Southwest region. So I'm responsible for Louisiana, Arkansas, Oklahoma, Texas, and New Mexico, and the 68 federally recognized tribes that are part of that geography. And my role is, as a representative of the administration, to make certain that all the services that the citizens of Texas and those other 4 states get related to health and to human services, most of which come through the state or in collaboration with the federal government and the state, that those services are designed in a way that makes sense for the community and for the people to benefit from those good services in collaboration with many of the programs that you heard about today. The emphasis on lowering smoking. CDC is in fact an HHS division, and certainly collaboration with many of the healthcare providers in and around. I'm speaking to you as well. All the good work that is done by private providers as well as community health programs and the public health program. Now, this is the first time I've heard about being able to win a car because you lose weight. That's a pretty great model. And one of the benefits that I have actually is working with communities and learning a lot about all the creative things that various small and large communities do to help make certain that their population has the best advantage possible to getting health care that is affordable and that is quality. And that's one of the reasons that the Affordable Health Care Act was created, was to make certain that people that perhaps had never been able to have access before to health insurance because of a pre-existing condition were denied health insurance that they could actually afford. One of the first persons that spoke was talking about childhood asthma. Because of the health care law, young children under 18, the minute the law was passed, could remain and not remain on their parents' insurance plan and could not, in fact, be cut off because they might have something like asthma. So many of you may be aware as well that, of course, starting in January and through starting in October 1 and through March 31st, there's been the opportunity to enroll in the marketplace. And the marketplace actually is available to people to afford insurance that perhaps in the past either they were not employed by a business that furnished insurance, health insurance, or they weren't over 65 and eligible for Medicare, or they weren't eligible for Medicaid. And so there was a big gap. There are about 50 million people across the country that did not have access to insurance because it was either unaffordable or they had a pre-existing condition that kept them out of the market. One of the exciting things for me to watch in the last 4 years has been that the dialogue that has been created as a result of the offering and the movement toward the marketplace for people that previously could not afford it, is that the dialogue that has occurred has been really creative. I'll have to tell you one of my more memorable opportunities was I was in San Antonio and had come back to Love Field and took a taxi to get back to my office, and the taxi driver had a bowl of apples in his front seat. And I said, "What's that all about?" And he said, "Well, my doctor says I need to start eating more fruits and vegetables." I said, "Well, that's pretty good." And he said, "And I exercised around the parking lot in the hotel before I picked up any customers today to get some exercise." Now, he had no idea that I was a regional director in 5 states. He was just having a conversation with someone on the street. And in my mind, I got chills, and I thought, we have arrived when there is that kind of conversation going on one-to-one with folks about personal responsibility and improving their own health. When we were talking about winning a car by losing weight, when did we ever have reality shows that dealt with weight loss? I mean, it is now a public part of the conversation about the individual responsibility we have and the opportunities as well that people now have to access health care because of the marketplace that is now available. Many of you may know the spotlight was on Texas. 4.8 million uninsured folks in Texas, actually some of the largest numbers across the country. Mostly, of course, in large urban areas. There are 300,000 uninsured folks around the Lamar County area. And what is it, 25,000, Paris has 25,000 folks. So obviously that's a larger area that I'm talking about. But when you think about it, this is an opportunity for people to be able to afford insurance that's comprehensive, that is available for mental health issues all the way through to prescription drugs, and a wide variety of 10 essential healthcare benefits. The other thing that has occurred is the opportunity for the public to know exactly what their options are by going to the marketplace and doing some comparison shopping, a little bit like Travelocity.com, where you can see all the same things laid out and compare prices and decide what your family situation is and what's the best match for your family if this is the first time for you to enter the insurance arena. So it is really an exciting time. Many of you may know that these things have been discussed all the way back to President Roosevelt. That's been a long time. So we've had Roosevelt, Nixon, Clinton, lots of people over time talking about the importance of looking at healthcare options. And through this mechanism currently, it means that many people can get insured. Young people can get insured depending on their income level and pay less than they might be paying for a cell phone for a monthly premium. So it's a wonderful opportunity to equalize access to health care for many people that have been cut out of that option for years. And Mayor and City Council, I want to thank you for the opportunity to come and visit with you about this tonight. And I'm looking forward to hearing from, I believe there's an insurance person that's going to be talking. And also there are navigators, people who can help enroll folks that do not have insurance and are interested in getting questions answered, but also interested in enrolling again as well. So, Mayor, thank you so much for the. It's good to see you again. I saw you in Dallas. We had a nice visit then, so it's great to see you.
Nice to see you, Ms. Betty, and thank you again for coming.
You bet. Thank you for allowing me to be here.
Thank you so much. Next, I'm going to ask Ms. Gina Berry to come. She has a brief presentation on healthcare market.
Good evening. My name is Gina Berry. I bring you greetings all the way from Dallas, Texas. This is certainly my first time having an opportunity to come to Paris, so thank you for the extended invitation on behalf of Congresswoman Johnson's office. Tonight, I've been given the task to share with you and your audience kind of a high-level overview, helping you to better understand the Affordable Care Act, and to kind of share with you a perspective of what you're in store for, how to shop for plans that are available on the marketplace, and certainly to make you aware of how you are going to be affected as a citizen by the new law. I feel somewhat a little awkward because I'm used to being turned around this way, so I feel like I'm talking to the back of the room. So I do apologize that you guys have to see the back of my head. It's just set up this way, so it's not intentional. So don't charge it to my head, don't charge it to my heart. First of all, I just want to share with you a little bit about why the Health Care Reform Act. Many people said, well, things were working fine the way that they were in the past. People that wanted insurance, they had insurance. People that didn't want it, they decided that they didn't want to take on it. So many people were a little frustrated saying, why do we have the mandate now being passed down saying that we now have to have health insurance, and many people feel that it should be their choice. So I think it's important that you understand why the law and the mandate was passed down. One, for the reason that you heard earlier, that there were many individuals that were part of our state and part of the USA that in the past were not able to have health care insurance for a lot of different reasons, and we're going to talk a little bit about that. Many of you may have asked the question exactly, how does it affect me as an individual? How does it affect me as a business owner? How does it affect me as a senior citizen? Some of the terminology that you see used here, and I won't go into all of it tonight, but certainly when you hear us talk about the individual mandate, when you hear us share the individual mandate, it has a lot to do with the law that's being passed, which indicates that each person has to have health care coverage. In the event if you're not exempt and you do not have health care, then that means that you're going to incur penalties, and we're going to talk about exactly what that looks like. What does guarantee issue mean to most of us? In the past, our laws were written one way. As we go into the new year, our laws have certainly changed. In the past, most of us remember having health care plans where we had to be in good physical health condition to be underwritten. As we go into this new season and this new year with the new mandate, it simply implies that every individual can have insurance regardless to any current or past existing conditions. The individual mandate is simply saying that starting 2014, that most individuals are required to have what we call minimum essential coverage or pay a penalty. In the event if you have coverage through an employer, if you have your own plan, if you're already on a plan, TRICARE, if you're on CHIP, you're on Medicare, those individuals are exempt, and we do not require that you have to take on any additional coverage. One of the things that I do want to draw to your attention is that we heard on the news a lot of people's coverage was canceled. One of the reasons those coverage plans were canceled is that as we go into the new year, those plans were required to meet at least 60% of the essential coverage criteria, and those plans did not. So that's why the plans were canceled. Many people have said, well, insurance coverage seems to have increased and the prices seem to be extremely expensive. I think I'll just take the shortcut, and I think I'm just going to decide not to have coverage. I'll incur the penalty. I think it's important that as citizens that we do understand how large the penalties are. Starting out for the first year of 2014, for those individuals, if you are not exempt, it's going to be a $95 penalty per individual, $47.50 per child, or it could be a total of $285 per family, or 1% of your family household income. As you can see, as we go into each additional year, the penalties start to get a lot stiffer. By the time we get into the year 2016, you could be looking at $695 per person, $347.50 per child, over $2,085 for family, or 2.5% of your family income as we proceed into 2016. Most people say, well, how are we going to cover that? How is it going to be taken care of? Uncle Sam will get his portion, and it will be taken out come April 15th. A lot of you have asked how the premiums set. One of the things in the past is that when premiums were being set by all of the different healthcare providers, they all had different criteria. We were able to mark up premium coverage based on if you were a tobacco user, based on your age, based on your geographical area. I think it's important that you understand that we've downsized that quite a bit, so there are still some limitations as it relates to how the premiums are being set for the new year. But it's a different ratio, and it has been lowered. Instead of a 3 to 1, at one time it was 5 to 1. So you can see that it has definitely decreased. Many of you keep hearing of terminology when you're on television, you hear the news, we're talking about taking you to the marketplace, and many of you have inquired what is a subsidy? A subsidy is basically where the government comes in, takes a look at your income, how many dependents, and based on your income, the government may or may not be able to assist you with a subsidy. I do want to show you some illustrations so that you can understand how do we determine a subsidy, what it looks like for some different categories and for different poverty levels. Certainly, it takes into consideration your income and the number of individuals that are part of your household. Here, I just want to show you a quick illustration. These represent federal poverty levels. As you can see here on this illustration, it breaks down a household. Each percentage is considered a poverty level, 400% being considered the highest. When we take a look at an income poverty level, say it's a household, one person, making $15,282, representing 133% poverty level. This particular individual would be required to contribute around $305 of their income to pay for health care coverage for the year. If we take a look at a 200% poverty level household, looking at two individuals, 200% poverty level at about $31,000, around $1,954 would be your contribution. Taking a look at a 400% household, which could be a very average household, 4 individuals, maybe a school teacher or police officer making around $94,200 a year with a household of 4. Your contribution at a 400% level is going to be around $8,949. So what are we really saying here? For each one of these federal poverty levels, the government has a mandate in terms of what percentage you are required to pay of your insurance. So for that individual that exceeds that 400%, they will be paying anywhere from 9.2 to 9.5% of their household income toward insurance premiums. Here's just a quick illustration of what it could look like for an example of 4 with an income of $92,000 with a benchmark premium being around $11,547 a year. Their contribution amount being $8,550 for the year with an annual government subsidy of $2,997. Keep in mind that there are going to be different metallic levels of plans, so your premium will be the same regardless to which plan you select. However, keep in mind that you will be paying the difference between each one, and we'll talk about what each metallic level represents for you as an individual. What are the exchanges? You're all familiar. You've heard Marketplace, you've heard Exchange, healthcare.gov, where you're able to go online, register, take a look and shop at all the carriers that are available online. You can also apply for your subsidy. So it's no more than a healthcare marketplace exchange where you can go and shop for insurance. However, on the exchange today, we do have carriers out there. There's Cigna, there's Blue Cross Blue Shield, and there's Aetna and Molina Healthcare. Are there other carriers that are available that are not on the exchange? Absolutely. There are over 120 different carriers that we represent, and the exchange, if you are going to qualify for subsidy, that's the place you want to be. If you do not qualify for subsidy, there's no need for you to have to shop on the exchange. It's your own personal choice. When we talk about the metallic plans, you've heard them talk about platinum plans, gold plans, silver, and bronze. Keep in mind, the higher the metallic, the more costly the plans are going to be. The top of the line are the platinum plans, which represent 90% coverage. Your gold plans represent 80%. A silver plan is going to represent 70% of the coverage, and the bronze is around 60%. However, the catastrophic are going to be for plans for individuals that are under the age of 30. One of the things that I would like to add is that certainly I will say that during my years in healthcare, that the plans that are available today in the marketplace, they're very robust, understanding that everyone can have insurance, but with that, it does come with a price. Here, what you see is all of the 10 essential benefits that are going to be part of all of the healthcare coverage. So as you can see, the list is very extensive in terms of anything from emergency services to maternity to laboratory services. All of the plans will cover all of these 10 key essential benefits. What do you need to know? Certainly, you need to begin to go on the exchange, take a look at premiums, decide on a carrier. You certainly need to be aware of what your budget, what you can afford to pay, and you want to make sure that you can really understand what's part of your coverage and what it's going to cost you out of pocket. Many people ask, can I keep my current plans? Many individuals that had coverage were able to keep grandfathered plans as long as they met 60% of the new criteria for at least another year. All of those plans cut off at the end of December and will carry over through next year of December. However, going forward, everyone now will be required to take part of an ACA compliant plan. Many of you may have asked the question, how do I enroll? You have several options that are available. You can apply directly with the carrier. You can go through the state health insurance marketplace, which is healthcare.gov. You can go through a web broker, and you can also deal with an insurance agent or broker like myself. Open enrollment is normally going to be October, November, December. However, for the rollout and the expansion of the plan for this year, you have until March the 31st to enroll. Once open enrollment is closed, there will only be open enrollment due to specific situations. We call those special enrollment events. So if something happens outside of open enrollment, things such as gaining citizenship, availability of any new qualified health plans, if you lose your coverage through your employer, any of those changes would be consideration for you to still be able to enroll once open enrollment is closed. Again, we talked to you a little bit about how do I enroll. You have navigators that are here today. They're going to share with you some information about how they can assist you on the exchange. There's access to call into the 800 number to do your applications, again, on the phone. However, understanding that as a licensed and a qualified agent, that we're able to provide recommendations for you and helping you to select a plan, and also allowing you an opportunity to explore and to evaluate all of the options that are available through the exchange on and off. And that's pretty much all I have for you. I went fast. I wanted to kind of give you a high level. I know you all have a lot of questions, and we won't be able to get into those tonight, but I did want to just kind of give you a high level overview and a perspective so that you can make the best decision for you and your family and know what you really want to look for in a healthcare plan as you begin to shop on the marketplace. Certainly, I would encourage each and every one of you to go out there, take a look at some of the definitions, because healthcare can be quite complex. Even though it may sound very simple that you can go out there and look at 38 plans, I'll assure you, if you have no clue what you're looking at, you'll be there 2, 4, 6 hours because they may all look the same. However, there are some similarities, but there are also differences. At the end of the day, you want to make sure that you understand, what is it going to cost me out of pocket? Exactly what am I paying for? What is my plan going to cover for me? And do I have to meet a $5,000 or $6,000 deductible before my insurance is going to kick in? So again, with that being said, I'd like to thank you for an opportunity to allow me to come in and represent Innisphere Insurance Agency on behalf of Health Markets. Again, I am a licensed insurance agent for the state of Texas, and we work with individuals, self-employed, and small businesses for helping you to take care of your healthcare needs. Thank you.
Thank you, Ms. Berry. I ask the two navigators to please come up and just introduce themselves and tell us what they do. So it's Gustavo Valenzuela and Linda Goodson. What is this sound coming from up top? The knocking sound? Wasn't it something? Okay.
Good evening. My name is Linda Goodson, and I am a navigator for the Community Council of Greater Dallas. And this is Gus.
My name is Gustavo Valenzuela, and I also work for the Community Council of Greater Dallas.
And what we do, we travel around to different counties and assist consumers with enrolling into the marketplace. We assist them by telephone if they need to enroll by the phone, or we assist them with enrolling by the computer. And we also, once they have received their subsidy or their tax credit, we will help them look at the different insurances and explain to them about the insurance, but we don't select an insurance for them. But we travel around. We have different counties that we handle. We handle Dallas, Collin, Kaufman, Navarro, what else? Ellis, and Denton, and we handle a lot more. But we travel around. We go to them. If they call, we go. And we set up appointments with them at locations like libraries or like a public, where we have Wi-Fi. We set up meetings with them at places that have Wi-Fi. And that's about it.
Thank you so much. And
Thank
we are
you.
planning something like that at our library, so we'll ask for your assistance. Thank you. So that finishes this item. The next item, actually, Kent, can I talk to you for just 1 second? After my presentation, I need you to pull this up on the internet. It's ePortal Paris. Yes. Yeah. The next item that is being discussed is item number 13, and this is more of a discussion rather than necessarily an action today, and that is discuss and act on e-portal system for the city of Paris. I've written this and I'm going to read it and then I'm going to show you a few things on it. Paris is a great place to live and do business. In my opinion, we are not getting the word out, whether it be by newspapers or electronic media or by the websites that we have, such as the city website or the PEDC website. I think we need to take extraordinary steps to promote our wonderful city. I believe adding this new approach to the existing sites will be a great tool for getting the word out about our wonderful city. As we progress in developing our new infrastructure, development at Coxfield Airport and Lake Crook, it is time that we start planning to market our city to attract developers and businesses into the area. This is not an economic development site for creation of new industrial jobs, since there is already a site in place for that. This is the new portal to introduce what our city offers in terms of quality of life and availability of land and services for new developments and businesses. What is ePortal Paris is? ePortal is a planned website which will function as the new portal for the city of Paris, Texas, to attract investors and developers to our city, providing easy access to information about the city. It is a site that will describe ongoing developmental projects of the city and possibilities of investments in such projects, provide easy access to different abatement programs in the districts that we have instituted in the recent past, easy access to a blog site where questions can be posed by residents and visitors about various ongoing programs in the city, which will be answered by the city manager and the mayor as well as senior city staff. Provide access to concierge services for people desiring to visit the city, and provide a list of city-owned tax delinquent properties which failed the auction so that they can be sold online. The city, furthermore, will be promoted in widely circulated papers, national and international newspapers, and will emphasize the prospects of doing business in Paris. These ads will carry links to this website. It will provide information on how to contact the pertinent city offices if needed, and also provide direct access to the mayor pro tem, the city manager, and the city planner. Now, this is not a completely designed site. We are just working on it, and everybody's input from the council to residents of the community will be welcome on it. Wait, if you can you pull it up? And this is just a very, very basic thing so far. It hasn't gone too far. So this is what the website, the preliminary plans on the website is. This is what it looks like so far. If you can keep moving it up a little bit, and it'll describe the, in the business-friendly portion, it says Paris strives to be a business-friendly city, with the city government working hard for business owners, improving the infrastructure of the city, and providing businesses with options and solutions to come to town. Paris City Council is an active elected body and is striving to develop Paris for its residents and visitors. Currently is working on projects to develop a lakeside community and its infrastructure. Go to the top of the page and hit projects. And what it does is shows a little bit about Lake Crook, and shows the little plans that our city planner has developed for Lake Crook. As I said, this is a very early phase of development of this site, And everybody is welcome to give suggestions on it, to say what it looks like and what they think should be on it. This has not costed any money for the city, neither is it going to cost any money for the city. This is all done by in-house work. Actually, most of it is done by my son and some by me. So, so if it doesn't look terribly professional, we are still working on it, and at some point when it gets to be a little bit better, then we might get some professional help on it. Go back up to the where it says contacts, and basically it will have all the contacts for the city council members, etc. So I just wanted to present this, and so that people have some thoughts, and when they start thinking about it, to write some ideas and give it to us to see whether this will be a workable site. If anyone has any questions about it from the council, I'd be glad to answer. Nothing, okay. Next, we move on to discuss amendments to the sign ordinance and provide direction to the city staff. Mr. Napier.
Good evening, Mayor and Council. First of all, I'd like to thank the sign committee for looking back and over the time we've spent together. We got to looking at this. We actually started this project last January, looking at our sign ordinance, and through numerous meetings, kind of got to the point where we are today. And what you have before you tonight is, or given to you, is the first page you're looking at is a summary. It's 3 pages of kind of the overview of the major changes in there. There's 3 pages of those summaries, each kind of bound out in a different area. 1 permanent signs, temporary signs, billboards, admin, and downtown historic signs. Going through that, what we would like to do is get input, comments from council, citizens, anyone interested. So what we plan on doing is putting this on the city's website in the morning with an email link. So if anyone has comments, they can download the ordinance. They can make any email comments they would like on that, and we'll try to address all those that come in. Committee may have to meet one more time to look at that before we present it to council again at some future date. Right now, maybe looking at sometime either last meeting this month or probably February would be a more accurate date of possibly meeting on this ordinance or trying to enact this ordinance.
So this is not an action item?
No, sir.
For
What
tonight?
we'd like to do tonight is just present this to everyone, give everyone a chance to review it, to look it over, to see what it is. You can actually go on our current website or going to and look at the current ordinance the way it stands versus this ordinance. And looking at it, what we've tried to do is go in and clean it up. I know I have to give Joey Sleeper a lot of credit. The former sign ordinance was about 13,000 words in it. The new ordinance is about 10,000, and we added a whole section on historic signs. So there's been a lot of cleanup in there. We think this is probably a little bit more business and user-friendly as far as that side of it goes. And you can kind of read through some of the proposed amendments. But I'd like to thank Councilwoman Drake for her input on this, as well as Alex Pickering on her Scott's Custom Signs, and Kent for all the work that these guys have put in on this. We put in numerous hours trying to go through each and every section and get what's best for the citizens of Parrish.
Thank you. I'll start on this. My comments are that I've read it and I think it looks very nice. Besides the fact, I think the Committee on Sign Ordinance has put in a lot of time and effort, and so I will go along with whatever the committee decides, and the thing that came in with our agenda this time, as far as I'm concerned, is perfect. I don't think I would suggest any changes to it.
One other thing, Mayor, I did send 2 copies with Priscilla to the library. So if someone does not have access to a computer, we have access at the library, plus there are 2 hard copies at the library for anyone who would like to see those.
Thank you. Mr. Wright.
I think it looked good.
Mr. Jenkins?
I agree. I think everything looks fine.
Ms. Lancaster?
Looks well thought out.
Dr. Grossnickel?
I think they've made some good changes.
Mr. Frierson?
Just one quick question, and to go to the downtown historic section. I assume these are all. Did anybody go over with HPC? And
these are HPC's comments.
Yep.
The committee. That's one of the last things we're waiting on. Is they met last Wednesday.
Okay.
This past Wednesday, so we could kind of finalize it on Thursday. So that's why you didn't have it in your packet,
right?
Because they only met Wednesday and
Okay.
made some changes.
Outside of that, no. I thank everybody for their time and putting the effort into updating this.
Ms. Drake?
course, I think it looks wonderful. Anyway, I do, again, reemphasize what Sean said. I appreciate all the hard work of the staff and the individuals outside of the city that helped. And I do urge anyone that to look at it, and if they have any comments, to please let us know so that we can have your input also.
Thank you. So I suppose the site will be on, and people can look at it and comment.
Yes, we're going to put it
Instead
on
of-
the main city's webpage tomorrow.
I don't think we want to delay too much, so I think most of the council is in agreement, unless there are some specific suggestions that come back. Let's put it on the
In 2
agenda for
weeks.
next time again, too. Item number 15, we're going to try to move relatively quickly now. Mr. Klinkerman, discuss and act on converting to paperless agendas. At our last council meeting, we had suggested to see if we can get iPads instead of the printed agendas. So Mr. Klinkerman is going to tell us about it.
Well, on your briefing sheet, I illustrated the different questions and challenges without looking at anybody in particular. The device is very greatly in price, functionality, ease of use. The technical abilities and comfort level of council members may vary greatly. Some may need a larger screen, for example. We just need some direction as if you decide to go with this, do you want Wi-Fi only or cellular as well? I gave you a total of 7 or 10 devices. There's 7 council members, 3 at the podium if you're going to go all digital. Do you want all of them to have it as well? Do you want them to have cellular connectivity? They can be secured and managed by Meraki and go to Assist for online assistance. If you're having an issue, we can log on to it remotely if it's turned on and connected and assist you and try to simplify it very much. It's already digitized by the city clerk's office, so we would just turn around and create a drop box, and y'all would have 1 or 2 buttons on the top. You click those and download them with your password, and then they would appear on your screen.
Thank you for your efforts on this. I have a couple of questions. First of all, cost-wise, does it become cheaper to go paperless?
I don't know what the cost is when it comes to the, I assume they're going to still make the paper to take to the library as a paper copy, or they're going to have to digitize it no matter what. You have all these different types, sources of paper coming to you, so they're still going to have to work with them and digitize them.
No, I understand, but that's not my question.
I envision one copy, one paper copy.
So all these printouts that keep going out,
There won't be any more.
okay, and that's what I'm saying. Will it decrease the cost?
I think that it will. It's going to decrease time, staff time, and it's going to decrease the amount of paper, because you figure that there's 14 copies of the agenda. If the agenda is 100 pages, you've 14 times, plus someone has to, put it together, copy it, stamp it, put it together.
Okay, and deliver it.
And deliver it.
Correct.
Okay, all right. So personally, I'm completely in favor of doing it. I don't think I would favor cellular connectivity. I think most places have Wi-Fi. So personally, I would go along with just a simple Wi-Fi like iPad kind of thing and be done with it. But we'll go through the council members and see what their suggestions is. So let's start with Ms. Drake this time.
The only question I sort of have is, like, I would have it at home to look it up, so I would use my Wi-Fi for my home.
Yep. Unless you have, if you got a device that had Wi-Fi, they all come with Wi-Fi.
Right.
So they have the option of cellular, so that you could have
But I'm just
connectivity
saying,
anywhere.
would each one of the council members have to have Wi-Fi at their home for it to work?
If you were working at home, yes.
Yes.
That would be, which I don't know how many people do.
Like I
I
said,
mean,
that's the only reason why I talked about the cellular side of it that
So
way.
let's find out. Once you're done with this, we'll ask
okay.
who
Well,
all
that
has
was my-
Wi-Fi at
That
home.
was my question, which I have, so it's no problem for me, but.
Mr. Frierson.
Fundamentally, yeah, I would prefer that over mounds of paper year after year, and of course, that's the green solution. My question is along the same lines as yours, Dr. Hashmi, on overall, is there any way to break out what the council spends in supplies? Is it even, just for a cost benefit?
Jimmy, just give
type?
you an estimate?
Yeah,
I would say between, this is a rough estimate without looking at the budget.
Oh,
and things,
Jean
but
is looking
paper-wise-
really bad at you, Jean.
Yeah, paper-wise, and I'm saying, but, maybe $3,000 a year. Staff time, you're, doubling that.
Yeah, staff time is going to be your cost
Yeah.
component.
Right.
Yeah. Okay, those are my only questions. I think it's probably a wise decision, but.
Dr. Gross-Nichols?
I think I'd be in favor of it.
Ms. Lancaster?
I'd be in favor of it.
Mr. Jenkins?
I'm fine with it. I think I like it.
Mr. Wright?
I'm good.
Okay, great. Now, my question is, who all has Wi-Fi at home? Anybody who doesn't have Wi-Fi at home? Mr. Wright, you have Wi-Fi at home?
No.
Okay, so what we can do for Mr. Wright is maybe we could just download it onto his whatever device you select eventually. Once a week you download it when the agenda is ready.
We'll work it out.
I
Okay.
get it.
Okay, all right.
We'll
And you will
work it out.
provide training for us, right?
Yes, ma'am.
Okay.
And support.
No.
Okay.
Nope, you're on your own.
We want everyone to be coming completely confused with the agenda.
That's never going to happen.
All right, so now this is a motion item, so can I have a motion on this item? Mr. Frierson?
Yes.
Yes.
Sure, I'll make a motion that we, what are we doing here? Move to purchase iPads for all the city council members for future agendas.
Okay, I'll second it.
There you go.
All in favor?
Aye.
Anyone opposed? No. All right. Item number 16, we're going to try to get through relatively quickly now. And I do have a turn off mic button today, just so that I'm reminding everyone. Item number 16 is discuss amendments to the tree preservation ordinance and provide direction to city staff. Mr. Godwin is
Yeah,
talking.
just very quickly, the ordinance is 43 years old. It's very outdated. It very much needs to be fixed like the sign ordinance, and that's all I have tonight. Just if you have any feedback for me tonight, or if you have any feedback for me or for the city attorney over the next few weeks as we work on this and bring you back an actual revised draft.
Thank you. Any council members have any issues with it? No.
Okay, we'll fix it. And if anything comes up, let us know as we go. If you think of specific issues or concerns that you or citizens have.
Thank you. The next item is to discuss incentives to encourage and assist downtown property owners and tenants to improve their facilities.
This is an item the mayor actually requested at the last meeting. If you'll recall, at the last meeting, which was 4 weeks ago, or tonight, the council approved, or maybe it was 2 meetings ago. Anyway, council approved incentives for residential properties to try to help preserve older structures, to do loan guarantees. And so the mayor was looking at, or wanted us to discuss things we could do, similar things perhaps we could do for downtown businesses, whether they be owners or in some cases maybe even tenants. We do have 3 grants in place now: Historic Facade Grant Program, the Historic Preservation Tax Exemption Program, and then the BIG, or the Building Improvement Grant Program. And we've had a number of successful applicants in those areas. It is something that I really encourage us to look at any opportunities we have. Downtown's a big part of our economy, and like the lake, for example, and the airport, it's a real asset for the community. It can be an even bigger asset for the community as we grow these businesses, help them, give them incentives to expand or improve or even relocate there from somewhere else into our downtown. So with that, I'll stop and just, if you have any thoughts or ideas, and it could be for a whole new program, or if there's things you think specifically that we need to try to accomplish, or perhaps you want to talk about making some of these existing programs larger. The big grant, I believe, is up to $5,000. The Historic Facade Grant Program is like $2,500. Does that sound right? So maybe, we want to make those bigger. I don't know. I'm not sure, what we want to do, but I certainly support whatever we can do to help our downtown.
Thank you, Mr. Godwin. I've read what you had written down, and most of those things are things which are already in existence. Mm-hmm. What I'm looking for actually is something new that will encourage correction, because in spite of what has already been in existence, not much has changed. So, in other words, whatever we are doing with those abatements or whatever we have provided has certainly not been very successful. Now, there may be some success and there may be some improvement, but it's certainly not changed the downtown that drastically. And so what I would suggest is that we come up with some novel ideas, whether it be tax abatements or whatever it might be, that you can come up with, or what other downtowns have done to, I mean, this Paris is not the only downtown with the problems.
Okay.
And to look at those and see what other downtowns have done to make improvements in it, other than what already exists. Now, we can propagate what already exists a little bit better, I think, but the thing about it is, I think that's still not enough.
Okay.
So that's what my suggestion is.
Okay.
I don't have I mean, I have written some specific ideas if you want, which I'll give you, but.
Okay. Just as you have ideas or thoughts, if you'd pass those on to me, I'll also meet with the Downtown Association, see if there's specific, there may be specific things that bar them from expanding or improving, things that we don't, from our side of the table, don't necessarily see. And I'll do some research on what some other folks have done too. Obviously, there's a lot of downtown, successful downtowns out there to emulate.
Okay.
And we've had, a good bit of progress, but the more the better, the faster it goes, the better we all are, I think, so.
Ms. Drake.
I'm in full agreement. Of course, and I have seen people apply for these, being on the Main Street liaison, and so I know people are applying for these, but I'm like you, we need to see what else maybe people have done, so.
Mr. Frierson?
Sure, and I agree. Any new idea should be considered, and anything we can do to not only expand and bring people downtown, but also help those merchants that are already down there, whether it's increasing the building improvement grant for stabilization improvements that they may need to make that's just drastically expensive based on the age and size of those buildings, so that we don't wind up in any other things. That would be the only other idea that I have.
Dr. Gross-Nickel?
Well, I've said before that I think McKinney has a wonderful downtown, and I would wish that would be a model we could somehow try to follow, and perhaps we could look at McKinney and the variety of businesses they have downtown and see if we don't have some of those businesses, and perhaps try to stimulate interest in somebody going in and setting up a store that would kind of, capture a new market for the downtown area. That's all I have.
Ms. Lancaster?
Well, under the building and improvements grant, I'm very, very concerned with the status of our roofs, and $5,000 for one of those roofs is just really not enough. And I've always said, if you don't have a roof on a building, you don't have a building. And we have a lot of buildings that need roof repair. I'd like to see more money put into that part.
Mr. Jenkins?
I kind of agree with Mr. Gross-Nickel. I think we need to get out and look around and see how other people do things, and we can go forward from there.
Mr. Wright?
I like the idea of incorporating the property owners to see what it is that would really turn them on.
Okay. So maybe if I can take this opportunity and say, if we can arrange a meeting with whoever wants to come from downtown, building owners, and see what the city can do in the form of ideas, and
Great.
proceed. Let's not delay it for too long. If we can arrange a meeting next week, let's put it back on the agenda for the following week. And I'd request each council member to come up with one idea for the next council meeting of what they think will help, so that at least we have a little bit more ideas here on that. Item number 18 is discuss request from Red River Valley Veterans Memorial to expand their lease from the city and provide directions to the staff. Mr. Godman will explain. If my understanding is right, that they want another acre of land next to where they have?
That's correct. We lease an acre to these folks, and as they work on the memorial, here we go. I did it wrong twice in a row.
Mr. Weiberg, you want to come and say something, or?
Here we go.
George would.
Finally. As they progress, they have a long-range plan, and they are hoping to continue to expand the memorial, which is a great addition to the city as well. And for what it's worth, I certainly support leasing another acre to them, in case y'all are interested in my opinion.
Good evening, Mayor Hashmi and the Paris City Council. I am George Wood. I'm the chairman of the Red River Valley Veterans Memorial, and this is Doug Weiberg, the former chairman. Thank you for giving us this short time for our presentation. John, if you'd advance that one slide, thank you. We are currently in our third year of construction of the 3 planned phases. We have 1,566 granite pavers already sold during this period of time. Also 79 specialty pavers sold. It's out front. These are mostly businesses. And 38 family benches sold and 12 tree pavers sold. John, if you'll advance it one slide, please, sir. Here you can see from the Paris Life, it's a little magazine that the Paris News puts out. They featured 2 articles about the memorial, with one showing the front of the memorial being lit for the first time with LED lights. The other is a visitor's guide to the memorial that we have had published. So you can also see the front entrance sign that was put there when they broke ground as well. John, if you advance it. Next, I'll let Doug speak a little bit about the school children visiting the memorial.
Well, some of you that were here 3 years ago when I talked to you, at that time we said that we were going to build a place to honor all veterans from our 5-county area, past, present, and future veterans. When we also said we were going to make a quiet and peaceful place for families to come and reflect on these veterans. The other thing that really is important was that we wanted to educate this generation and future generations about the services that people in their families had done. And as you can see in that picture, we've had for the last 2 years busloads, probably I think 6 busloads last year, of 2nd grade teachers, 2nd grade classes come to the memorial. And when they come in, we tell them what it's all about, and we just the same things that I just told you, and we teach them flag etiquette, and they love it. We teach them how to salute, and they even like that more. And we show them family benches and everything, and they're just so excited. I've got to tell you, last March when we did it, a little fella come, 2nd grader, he came running up to me, eyeballs really big like yours. And he said, "Mr. Weiberg, I found my grandpa's name here." And he was so excited. And I said, "Well, let's go look at it." So while we were walking down there, I said, "Was he in one of the wars?" "Yeah, he was in World War XI." I'm still laughing about him. But at any rate, that's really important to us, to teach futures what they need to know. The second thing I would like to say is that, I think it was 3 years ago, we started a Memorial Day service, and it was really good. Last year, we knew it would be better. We put out, I'm thinking, 300 chairs, and we had 100 people standing. This year we're going to do better. It's really gotten to be a thing where people can come and reflect again on those veterans of their family. On Veterans Day this year, you'll see I gave each one of you a coin, except Janice. I miscounted Janice, but I'll bring you one. Okay, all right. You'll see that coin, and we gave that all to the veterans that came on Veterans Day. And as you can see, it's got a picture of our country's eagle on the front, and on the back it has local kids standing and saluting and saying, "Thank you for keeping us safe." And it really made a difference with some of the veterans when we gave them to them. So if you are a veteran, of course, keep it. If you want to give it to somebody in your family that's a veteran, that's fine too. Any questions?
Thank you so much.
I'll turn it over to him.
Mr. Wood and Mr. Weber. Now, this is for Channel 12 News. Please don't keep recording the bald spot on my head. I've been watching it for quite a while now. Okay. Ms. Drake.
The memorial centerpiece is the Ring of Honor, which honors all the soldiers that's killed in action from one of our 5 counties, from the Texas Revolution all the way through Afghanistan. Also included next to the Ring of Honor are conflict walls that will have depictions of these wars. We want the memorial to be a place for reflection, remembrance, and gratitude to educate present, future generations of the sacrifices of our armed forces, and that freedom is not free. Slide, next slide. The Red River Valley Veterans Memorial wants to bring in more tourists to see our beautiful city of Paris, Texas. We want the memorial to be something that the city of Paris is proud of, and 5 counties that we represent. We have built most everything out there with donated money, donated labor in some cases. We are very grateful for all the help that we have received so far. As with any nonprofit 501c3, funding is always hard to come by. We're always out working on donations and ways to fund our project. We have a great board of directors and committee. This year we have plans and goals already in place and should have over 2,000 granite 1-foot by 2-foot pavers installed by next Veterans Day. We have been working on electrical service, landscaping, and plan on having most of our work completed by the end of the second quarter. With all the granite and statues planned, we have decided to install in-ground drip water sprinkler system throughout. This will greatly reduce the water usage. We've also decided to install all LED lighting throughout, which will reduce our electricity cost and provide many years of reliable lighting. Next slide, please. Yes. In the green, you'll see the current memorial, and in the light blue, you'll see an area that we are asking for. The city of Paris could greatly help the memorial by providing us with free water for our drip irrigation system and this piece of property. Next slide, please. Here are a few examples of what might be included as well in this garden area. So you can see a Civil War cannon, a UH-1 Iroquois, Vietnam Air helicopter, P-51 Mustang, whatever we can come up with to put out there that'll be mostly elevated to keep the kiddos from climbing on it, and trying to get hurt or something. So we're going to try to make it a safe place, ADA compliant, so everybody can get around. So we've got great plans on this memorial. It's way out there before it's ever going to be finished because, again, it's money. But we need room to expand. Next slide, please. The Wall of Honor would be a place of remembrance for those who died while on duty but not in combat. We have the Ring of Honor. Those are for soldiers that died in combat, and we want to leave it like that. We don't want to mix other people that died in with those that were killed in action. So we're looking at creating a Wall of Honor for all other soldiers that actually died while serving in the military. The Memorial Niche Garden would be a place that veterans and their spouse could have their ashes entered. So this is another idea that we came up with that we thought might be a neat thing to put out there for the veterans that may not can afford a decent burial place. And if they'd like to have their remains cremated, we could build this wall and have a place for them to put their ashes and their spouse. And we'd like to thank you for your time. And if y'all have got any other questions, yeah, I got those for them.
Ms. Drake?
Yeah, one. You'll pass those out.
I get cold chills every time I go out there, especially when I see my dad's. I just think it's a great thing that y'all have done thus far. And myself personally, I thank y'all. And I would like to see the city do whatever we can to help support y'all and to go forward.
Thank you.
Mr. Frierson?
I agree with Ms. Drake. I think we should support it however we can.
Dr. Gross-Nichols?
Well said, Leon. It's great.
Ms. Lancaster?
It's a wonderful memorial. I really appreciate the work that you've done on it, and I agree we need to support it.
Mr. Jenkins?
I think it's pretty nice, and I like the project that y'all working on right now. I hope we can go forward with it.
Mr. Wright?
Appreciate the effort you guys have put in, and it's a great thing.
Thank you.
Obviously, it's a great project. What I would just say is, if their request is to get another acre of land, if we need to bring it back to the council for approval, I think we should do it. And I think if they're requesting that water be given to them, then I would favor it. But we'll go with the rest of the council, whatever the council decides to do.
Yep.
So if you need to bring it back at some point.
We'll bring back, put it on consent.
Yeah.
Everything that we're doing out there, we're trying to conserve energy. That includes by doing the drip lubrication, it's going to take less water, be less evaporation, just like the LED lights. We've got to fund this thing for many years to come, so we don't want it to be a financial burden. We already have over $23,000 in a perpetual care fund that's slowly incrementing up, but that's for perpetual care for many years to come. It's not for expenses today.
Thank you very much.
Okay, and anybody that would like to have one of these will be outside handing these out after the meeting.
Item number 19 is discuss Christy Foster's request to assist with development of community garden program and provide direction to the city staff.
Go ahead and introduce yourself.
Hello, Council. I'm Christy Foster, and I'm the one who first initially brought this forward. It has not been just me working on this. There's been a whole group of us working, and this is one of my constituents, Edna Clegg, and she actually has something she would like to say.
Good evening. Good evening. My name is Edna Clegg, and I'm here tonight representing Seeds of Hope, which is a community gardening initiative that combines the efforts of diverse people and organizations to grow, harvest, and share and eat healthy food. Centrally combining and coordinating individual efforts, grants, and donations will yield a citywide self-sufficient and sustainable community resource. We will improve community health physically by increasing the availability of fresh fruits and vegetables while providing exercise to participants. Socially, by encouraging community and personal responsibility and providing education on nutrition, gardening practices, and food preparation. Economically, by developing a sustainable local food system, creating new jobs, and increasing per capita production. It is our sincere hope to end hunger and poverty in our community by affording each citizen the opportunity to benefit from access to self-grown produce. There are many organizations currently involved with Seeds of Hope, including First Baptist Church, Christian Women's Job Corps, the Salvation Army, Red River Valley Landscaping, the New Hope Center, the Agriculture Extension Office, various Master Gardeners, Lamar County Young Life, Red River Baptist Association, Women's Ministry Union, And Jimmy Dog Nicholson from the Lamar County Probation has voiced interest should we be able to guarantee water be made available to the sites. The time has come for each church, civic organization, school, neighborhood, and in fact, every citizen of Paris to become involved in the community garden effort. In addition to the use of city-owned lots, Seeds of Hope is encouraging churches, organizations, businesses, and individuals to use their own available lots and resources, such as First Baptist Church and Michael and Carol King have chosen to do. Examples of present and future plans include hosting gardening classes for all ages, creation of a seed bank, wheelchair accessible plots, greenhouses that will enable year-round production, online farmers market, and school programs. What we're here for tonight is the local weather makes another source of water very important to our efforts. We implore the city to make available allocations from the city water supply at the locations so equipped. This strategy, combined with passive water rain collection and on-site water resources, will help ensure the success of our project.
Thank you very much. Mr. Godwin, you want to add something?
Just, again, this is kind of a long line of really neat stuff going on in our community these days, which shows the kind of people that we have living here, and I sure am glad I'm living here now, too, for the last year. This is a neat project. These things really do work. I've seen them live work, and you're not asking my opinion, but I really recommend that we support these folks any way we can as well. This is a neat thing. It's good for a community, and it's something that people are volunteering to do to improve our community. Specifically here, we're talking about improving vacant lots that we own, that we sometimes have to maintain anyway, that cost us money. So they're doing us a favor as far as taking care of, we have so many empty city lots around town that our code enforcement staff is stuck taking care of. So again, I wholeheartedly recommend this. I think this is just yet another a positive thing for our community.
Thank you. Any of the council members have anything to add? All in agreement, I take it? Dr. Grossman.
I'm in favor of it too. I just wondered the level of support we're talking about in terms of having a city truck bring water in, or
We were thinking that the ones that were already metered, we could tap them for certain hours of the day. Because we don't want people watering, we're going to try to have fair laws and everything, but we don't want people watering in the heat of the day and that kind of thing.
And of course, not to go into it tonight, there's restrictions on giving water away, obviously, too. So those are kinds of things we'll have to look at. But, given your acquiescence, we'll do whatever we can within reason, and then bring something back to you to, formally adopt, just like with the last group.
Yeah, I have one quick question, and I think it's a noble opportunity for everybody to enter into. Is this conceptually going to be like a formal partnership between the city and this organization, or how is this?
I think that's probably the way to do it. Is like a service agreement, like we do with other nonprofits that we actually give cash donations to in some cases.
So there would be like a contractual deal where
correct, where they're providing a community service and we're providing assistance to them.
But the city's liability would be limited since it'd be taken.
Right.
Okay.
Right.
Just want to make sure.
Yeah.
Anyone has any other comment? So I take it that the council is supportive of it, so to go ahead with it, whichever.
We have a meeting scheduled Wednesday morning, or y'all do it.
Wednesday morning.
Hopefully
Yes,
be there
we'll be
over
there.
at First Baptist Church Wednesday morning, so.
All right.
Great.
Thank you very
so
much for your time.
One thing I would like to invite you all, we're having our first groundbreaking on the lot that First Baptist Church has donated. We're going to be having it February the 9th at 1 o'clock, and I'm formally inviting all of y'all to attend if you would like to come. And we are really excited about this, that we can actually get this done, and so that way, if we have your support here, if you would like to come, it would actually show the city, the rest of the city, that we are trying to do something really good.
Thank you.
I do have a question. What side?
It's over at the First Baptist Church, the old volleyball court. The address is actually 322 Austin Street. It's right behind the parking lot of, I do believe it's the Presbyterian Church, but it's right by the city, the Family Life Center.
Okay, thank you.
Thank you.
Anybody has any other comments on this item? No. Okay. Moving right along. Item number 20 is discuss and act on securing additional private contractors to assist with storm cleanup and authorize possible expenditure from undersigned reserve. Mr. Godwin will speak on this, but I want to give a little quick update on a couple of things that, number one, I've in the process of getting in touch with the Bonham prison and to see if their inmates can come and help us again. And that is going to be done tomorrow. So that is one little update for that. Number two, I've also approached the Corps of Engineers to come and help out in this. So I'm waiting to hear back from them.
Okay.
And I know you're going to have a presentation on this, but I just want to point out one thing. Since you've written private contractors, if we were to get private contractors, wouldn't it mean that we'll have to bid it out and then get the bids in? I mean, will it not prolong the process tremendously?
Yes and no. We can hire contractors for less than $50,000. They can be working while we're preparing formal bids for larger products,
Okay.
or larger projects.
Or the other choice would be to have temporary help.
Correct. But temporary, as far as people, just people?
Yeah. Meaning the city has hired temporary employees to get the work done much faster.
Right.
In the sense.
The problem with that alone is we also need equipment. We need people and equipment. In the case of contractors who specialize in this sort of a thing, they can move a lot faster than most of our folks. We have people from a number of different departments helping out, and they're doing a great job. But it's not what they do on a daily basis. And so the idea is to bring in some experts that could really move it a lot faster. But,
all right, that's fine. Go ahead with your.
Okay, well, I won't go into a lot of detail. Sort of try to answer any questions you may have, but three things I wanted to say. One is just a comment, and that's to publicly thank the city staff that's been out there, especially the first couple of weeks after the storm, out there all day and literally for a while all night. People have been working outside of their normal jobs, working long hours, working on weekends and so forth. So I really do appreciate that, number one. I want to say that publicly. Number two, however, we can't do this all by ourselves. We don't have enough people to do this by ourselves in a timely manner. Now, we could do it eventually, but by eventually I mean, I don't know, maybe next summer or next Christmas or something like that. Keeping in mind that, again, like I said, this is what we do on a daily basis. For the most part, one or two people do this on a regular basis, but out of all the folks that are working out there. But also they have regular jobs, and so our street guys need to get on the streets once the weather starts getting a little bit warmer here in the spring, and our parks folks have softball coming up fairly soon. And we need to clean out ditches because wintertime is when our parks guys clean out ditches, and so they haven't been able to do that because they're working on this, and on and on and on. So ultimately, we need to be able to bring in additional people, and if you give us the go-ahead, we'll hire, starting as soon as tomorrow, we can bring in additional crews, we'll rent additional equipment, we'll hire temporary folks as well. And while we're doing that, we'll also issue a request for proposal or proposals and perhaps issue bids so that if we do need to exceed $50,000, and we almost certainly would in several areas, that we can do that, but don't wait for those bids to come back in. And then the third thing I want to say, or the second thing I want to ask the council is, based on our longstanding policy at the compost site, which is where people normally drop off brush and limbs when we don't have the every 13-year ice storm, the only folks that are supposed to go out there are individual residents, and they're supposed to show a water bill or a driver's license, and I just want your permission to waive that. Now, I still want to require that, but I want to make it okay for contractors to show a water bill or a driver's license. The reason I still want to have that part is that I don't want, frankly, somebody from Reno or from Sulphur Springs or from Oklahoma driving down here and using our services for free. But I just don't want to discourage anybody inside the city limits of Paris, whether they're using a contractor or they're hauling it in the back of their own personal pickup truck, or they got their grandson or their next door neighbor or the kid from church helping them out. We want to encourage that. So that's contrary to our policy. So first thing I'm asking is let us begin spending money in hopes that we'll get reimbursed by FEMA, but if we don't, we don't. And then number two is to waive our policy and allow folks, contractors also to drop off for the next 2 weeks at our temporary site, and then hopefully we'll go to the compost site beginning February 1st. That's our goal.
Thank you, Mr. Godwin. Before I open it for comments from all the other council members, I think there is a sheet that Mr. Godwin has provided, which shows the city to be divided in different quadrants for the cleanup process, correct?
Correct. And the maps show the streets that have been cleaned. Now, you may immediately look at one of those streets and say, no, it hasn't, and that's part of the problem that we have, and that's part of the reason it's going to take forever with just in-house people, and that is, and I'll take Church Street as an example. Church Street and I think Main were the first 2 streets we did starting 2 or 3 weeks ago. Well, by the end of the day, people had put new stuff out. And every day, people put new stuff out. A lot of yards haven't been cleaned up yet. There's a lot of tree limbs still hanging up high that people haven't cut yet. If you ride around town, and you've all seen that, there's a whole lot that hasn't been put on the curb yet. So a lot of these streets, we're going to have to do 2, 3, 4, 5 times before they're all done. So those blue streets are cleared, but in real life, they're not. In fact, a lot of them are as much as 90% full as they were when we did them the first time.
And I think, Mr. Godwin, one of the things that can be done is, I think if ahead of time people are informed of which street is going to be done on what day, so that they anticipate this and they put all the brush out rather than back and forth, back and forth. So I think there should be a definite scheduled, planned thing, well advertised in the paper and e-Paris or wherever else, that that street is going to be cleaned on such and such day, so that it doesn't become a city's responsibility forever to keep doing it. I mean, this process may not end forever otherwise. So one of the things would be to have a proper timetable of...
We certainly will try to do that. The problem is, it's always hard to know just exactly how long it will take. And if you tell people, we're going to get to your street next week, and then you don't, they get even madder at you than if you don't tell them that to begin with. So that's one of those ideas that there's a lot of merit to that, and we'll try to do some of that, but we're trying people's patience already, to be honest, and so we just need to get it out of here.
Thank you. So. And my suggestion to the council would be that if the council would take action today and approve some funds for that. So we'll start with Ms. Drake. Ms. Drake.
In looking at your options, John, have we looked at possibly renting equipment to have more equipment on hand?
Yes, that is one of the things we
people?
plan to do.
Okay, because I had gotten online and started looking myself
Yeah, in fact,
for that kind of stuff.
we have quotes on equipment, we have quotes on crews. So given the authority tonight, we'll start doing that as soon as tomorrow morning.
Okay. And I guess my next comment is, we've got everything divided, and I appreciate you getting this report to me or for the whole council that I requested, so that we would sort of know what areas had been hit, because I've had numerous citizens asking, where, and I said, I don't know. I said, I'll have to find out. But is there any rhyme or reason as to where they're going first? And, it just, I guess I'm looking at, and I've read some of your comments, but is there some reason why we don't start at the south? I'm just using this example, south edge of the city, and go to the north and do everything running east and west, and then go east to west and do everything going north and south. So we're not just here, here, and here. Those are just
and in fact, the pattern is that we started in the center of town, essentially Main Street, Church Street, First Street, and from there we've been moving east and we've been moving west. Now, the downside of that is if you're on the far east or the far west, we're not close to you yet for the most part.
Right.
But yeah, it's an arbitrary choice, because no matter what you do, you're going to be arbitrary. Somebody's going to be first, somebody's going to be last. But the process was, from the beginning, we started right in the middle of town and then moved east and moved west simultaneously. Now, we did have some folks out starting, I think today, this is Monday, yes, who started around 20th Street Northeast. So we're kind of trying to make a dent over there in that area. We did a couple other streets last week on the far east, but for the most part, we've tried to just be methodical and start in the middle and work our way out.
Okay. I just feel like whatever we decide tonight, we need to get a decision made because our citizens have waited a long time for this cleanup, and I think we need to, my opinion, that we need to do something to go forward. Do you have an amount that you are looking at? And Jean, where are we looking at for funds of pulling from? I guess it's two.
Well, Jean comes up, you've got unbudgeted reserves, but you obviously you have policies that restrict how much of unbudgeted reserves you can spend.
And then have to pay it back.
Now, right, now there's two sides to that. One is the reason we have reserves is, one reason is because of bond covenants and bond ratings. The other is if you have a rainy day. I hope this is the rainiest day we have in a long time. And so from my perspective, and I'm almost as cheap as Jean, I would say this is one of those times we need to cough up the reserves. Because again, it's you like at your own home, you put some money in reserves or in your savings account so that if something happens, you've got the money. And then you need a new roof. Well, that's what it's for, is to, and you hate to take that money out of savings because what if we have something else go wrong real soon? But again, I think that's what it's there. But you do have a requirement. It's 18 months, I think, after it dips. We've got about $9 million or so that's truly there, but that's not all money that's spendable. There's a lot of earmarks here and there and so forth. We're at the time of year where we'll be hitting our peak because people are paying their property taxes here right now, but that's money that's going to get spent, so you can't count on that high January revenue. Jean, I don't have anything to add to that, or?
No, I just think that whatever you do as part of that plan, you need to plan for how you're going to replace that reserve to get it back up, to that minimum level within the time period specified in the policy. Otherwise, you could have some adverse effects next time we go out to do a bond issue, like if we went out to do the $10 million on the 2013 issue that we've talked about doing. They're going to look and see, we've got this policy, did we follow it?
It's real money. FEMA came in Thursday of last week. Their estimate was $1.2 million. We don't think that's nearly high as it really is. But if we spent $1.2 million, that's huge. I hope we don't spend that kind of money. If we do, I hope FEMA pays us back. That's still an unknown too. And we don't know even when they're going to give us word. But I think we at least need to begin doing some of those things. And I suggest just putting this on your agenda every 2 weeks. That way every 2 weeks how much we're spending. We can stop or we can accelerate as we go. But I just think we need to, I'm repeating myself, I just think we need to spend some money now.
Well, I think we do too, but how much are you thinking about at this point?
I think at this point, between now and the next meeting, a couple $100,000 would be not spent but encumbered. That includes the equipment. We've talked about renting, some of which we'd probably rent for 2 or 3 months because we get a cheaper price that way. Right. Also the additional crews, and those would be limited to $50,000 per project, so to speak, because of the bidding laws. And then hopefully we can get stuff bid or an RFP put out before your next council meeting, or maybe we will even have to have a special council meeting for you to approve low bid or low bids or a best proposal from an RFP process.
Jean, what would you feel comfortable with as far as the finance director?
Well, I think John's in kind of the right ballpark to start with,
get us
rolling, and then every now and then he gets it right, but he's not nearly as cheap as I am. But if you had $200,000 or $300,000 is kind of what I thought would be a good starting till we get a little more better footing.
Yeah, I think we need to. This is my opinion. I think that we need to go forward and allocate some money tonight so we can get this started and get these. I know some people think there's not a fire hazard. I think as it gets drier, it's going to become more and more a fire hazard, plus bugs and rodents and everything else hiding in it. And, our citizens, they pay a lot of taxes, not a lot, but I mean, they pay taxes and they deserve to have the things cleaned up and the process done as far as living here in the city of Paris. And so my recommendation would be to allocate some money tonight to go forward with the cleanup.
Mr. Frierson.
Well, thankfully, Ms. Drake said a lot of what I was going to ask about, but overall, is there a scope of the project? I mean, any idea? I've seen lots of things bannered about in the press, but as far as what the total damage or cleanup?
Well, you know, again, FEMA estimated it based on, I think it's 350 cubic yards per mile.
Right.
And we have 174 miles of streets, and then they figured $20 per cubic yard, and that came up to $1.2 million, give or take, and we spent about $300,000. So that's where they got their $1.5 million.
Right.
Our belief is that that's too low of an estimate because they just drove a few streets. You know, you have this image of FEMA that comes out, and they just picked out a few streets and then they multiplied it out, which, you know, I understand their job is pretty huge, but we think that's too low because we think most of the streets have more than 350 cubic yards. Plus, there are so many people that haven't even cut stuff yet. Right. You know, look in their backyards, look in their front yards, look on their roofs in some cases. So that's why we think it's too low. So we think it's well in excess of $1.2 million.
Okay. And then one other question that you mentioned, as far as removing the debris with the contractors, you want to limit that only to locals?
Yes, the current policy says, and we've been cheating, so to speak, since the beginning, we're not supposed to let contractors use our site at all. But we've been saying you can come in.
Right.
And we talked about, okay, we need to start following our own policy, which is only individual residents with a water bill or a driver's license. But I'm just asking you to give me permission to keep cheating and let anybody come in as long as they're really from Paris. Now, I don't want to cheat for people from Reno, nothing against Reno, but they don't pay taxes here. But whether, you know, Mr. Smith brings it himself, or whether Mr. Smith has the neighbor kid do it for him, or Mr. Smith hires Ray's Tree Service to do it for him, I think we want to help Mr. Smith as much as we can as far as a place to drop off. I mean, as long as we've got capacity, and we do. Between the burning and the mulching, we've started mulching pretty significantly today. We had some mechanical breakdowns in the last couple of weeks, but we've got a contractor out there now, or again, and we're keeping up with the volume, at least at the drop-off sites.
But do you think that will significantly slow down the removal process if people have someone from out of town and they just drag it to the curb? And wait on the city to come?
Yeah, I think ultimately the reason we want to do this is not to be nice guys, honestly, to let contractors from the town continue to come out to the drop site, is we wanted to make it as easy as possible for them to haul stuff, because what they don't haul will get left or it'll get dumped. And you know, I was in the landfill business 20 years ago in Florida, and I learned that the hard way. If people come up to they load up a trailer or a truck and they come to the gate and you say, oh, you can't come in here, they're not taking it home. It's going to end up somewhere. And then the other thing is, we don't want people to just leave it. If they'll haul it, you know, we want to help them any way we reasonably can to get that done. Because the more they haul, the less we have to spend out of our reserves to do it for them.
Okay.
Dr. Grossnickel?
John, I had some questions about how this is being done. I mean, are we just having men put on gloves and toss the limbs in a trailer and hauling it to the dump site where it's burned? Or do they have mechanical, like a skid steer with a grappling thing?
There's actually there's a combination of things we're doing. In some cases, we do have a few people doing that, depending on the type of debris, the type of crew we have. We do have the single grapple truck that's part of our sanitation department, and that's the gentleman who normally goes around all year long picking up. You know, you can put brush out once a week or once a month, twice a month, whatever. So we do have that. We do have smaller equipment that we've rented already. We have our code enforcement crew, our CIP crew. We have almost all the streets folks. And then most of the park people too are doing that. Some cases they're using bobcats, in some cases they're using other types of loaders. So whatever equipment we have in hand that works from those different departments, and they're loaning equipment to each other. So it's not a whole lot of just hand one thing at a time. As much as possible, we're trying to do it mechanically.
So if we are doing it this way, then you've got to worry about liability issues. You can't just hire somebody from the Texas Workforce Commission for day labor and send him out. And are they doing any grinding on site? I mean,
no. We have a contractor who's doing the grinding at the compost site.
Okay. What kind of contractors do you have in mind locally? I mean, do you have any people that?
Right now, we have two crews working for us already that are getting rid of hangers, and by hangers we mean high tree limbs that are going to fall next week, next month, next summer, but they need to go before they fall on their own because you don't know who's going to be around or what's going to be around when they fall. So we have a crew, one company with 2 crews doing that right now, and the idea is to bring in additional crews, and they would have the best equipment that we have one of right now, the grapple truck, where they can go very quickly and pick up a whole lot more, larger truck, larger grapple, so forth and so on. And then we would also rent some other different kinds of equipment for our in-house people, because in some cases we've got people doing it kind of the slow, old-fashioned way. If we can get them better equipment by renting equipment, then they can go faster as well.
But you do have to train them in the use and make sure that they're able to operate it safely.
Right, right.
And so I guess, before I thought, well, we could just hire manual labor cheaper than entering a contract, but I'm not sure that that's true if we have to really train.
There's a little bit of that we could do. We have enough operators on staff in different departments to operate quite a lot of equipment, but we don't necessarily have that much equipment that's designed for that purpose. We've got backhoes and we've got different things, for example, in water and sewer utilities, but those aren't really, worthwhile for this type of procedure. Plus, most of our water and sewer guys are fixing water and sewer leaks like crazy, because this is also a bad time of year for water and sewer leaks when the weather changes.
Okay. And one last comment about the areas that you're doing. It just seems like some of I'm glad to hear 20th Northeast, because it's a major thoroughfare with curves and twists and turns. And I think if we can concentrate at least somewhat on some of the busier, high-traffic streets, it will improve visibility and safety, because I know we've got a pilot too at my house that, it's just hard to see when who's coming at you from both directions.
Speaking of that, if I may too, there's certain areas that it causes us to go slower, but they're things that we try to look for, and that is if you see any blind spots specifically, we try to eliminate those, even if we'd have to take them out of order. If it's covering up water meters, if it's covering up, if it's causing a drainage issue, if it's at a bus stop. In fact, we've talked with the transportation folks at PISD, letting them know, hey, if you have trouble with kids getting on buses at a certain area, let us know. We'll make that a priority. But big things are blind spots and kids getting off and on buses. And so we'll put those safety things at the front of the list too. So if any citizens or anybody or any council members, you see a spot or hear about a spot, let us know, and we'll take those out of order. Makes us go slower, but we just, obviously safety is more important than the other stuff.
Okay. Thank you, John.
Ms. Lancaster.
Well, I wanted to make sure we were putting quick emphasis on the main streets coming into town. Particularly noticed that we have a lot of limbs and larger tree trunks on Bonham Street, starting somewhere around 19th Street and then all the way out. And you do have a lot of school buses there, and those things are lined pretty solid in some places. Pine Bluff is another one, very heavily traveled, has a lot of limbs on the side there, and they're also trying to do sewer work at the same time, which is really, you got a lot of things going on there, and I certainly wouldn't want anybody to get hit while they're doing that work. But I'm definitely in favor of moving forward and getting that additional help.
Mr. Jenkins?
I think the prior members have covered a lot of the bases on what we need to do, and I know it's pros and cons to it, but I think we need to kind of give a little heads up to what area they would be in, so people can know what's going on.
Okay. Mr. Wright?
Yeah, I would think that we should go ahead with contractors on a limited scale and pursue those other possibilities, and meanwhile be prepared to do RFPs for larger contractors.
Great.
I think everybody has voiced the different things. I'll only say one or two more things, and that is, I think it should be, once you come up with a plan, first of all, I think there needs to be a liaison person who's in charge of the cleanup process, rather than a haphazard way, so that the person knows precisely where the crews are, which areas are to be cleaned, what is the sequence of events. If you want to do it as a city manager, you can, but I think it's too much work for you. I think there needs to be a proper liaison cleanup individual responsible for the cleanup of the city. That's one. Number two, I think once we have some sort of a timetable, I think it should be made very clear that once that the city crew has been by and picked up everything from off that street, that if further things are to be accumulated, the resident becomes responsible for dropping them off. So that it doesn't happen that the crew keeps getting pulled back and forth on the same streets. And with that said, if nobody has any objections, I'll make a motion to approve $250,000 as an emergency fund to be taken out of the reserves and be replenished as soon as either FEMA replaces it or come up with an idea of how we're going to replace that fund.
I'll second that motion.
All in favor?
Aye.
Anyone opposed?
Thank you.
All right. If I can make one request, and that is, if we can please move item 22 and 23 up, and then we'll let Mr. Wright come up. So can I have I'll make a motion to move item 22 and 23 up.
I second that. And I'd like to say on 23, I think we
have discussed it.
probably discussed it.
Yeah.
Because the way the agenda read when we got it, it didn't sound like we were going to be able to discuss these things. And I think since the article came out in the paper about private contractors and the water bill and everything, I think you have now sort of changed on that, and that's what I was wanting from the city, was to go ahead and allow those contractors and
So we'll
stuff like
consider
that.
item 23 as discussed.
I think
We'll bring item 22 up. I'll make a motion to move it up.
I second it.
All in favor?
Aye.
Okay. Ms. Lancaster, item number 22 is discuss and act on permit fees during emergencies. This item was placed by Ms. Lancaster. She's going to discuss that.
Well, this was in regard to broken pipes. And I was made aware that we were hitting a time when things thawed out and people were discovering that not only did they have all these trees all over them, they also had pipes broken out to outbuildings, and we were gathering as much as 100 calls to cut off the water, and of course there's a fee for doing that, and ordinarily no problem, but it just seemed like it was dumping on people who already had all the problems they could handle with trying to pay for gathering up all those limbs and having those hauled off. And I was wondering if it was not possible to suspend that fee, which is $25, to citizens, starting with right about the freeze till maybe next week, because it's just one more expense that they're having to bear.
To all of those that have broken pipes.
Yeah, every time you call and have someone come and turn it off, if you can't turn it off yourself, it's a $25 fee. Well, I know of one particular day last week, there was over 100, and they gathered for a short time as many as 100 to 150 a day, which mounts up, and maybe $25 is not all that much, but it helps the citizens.
Jean, there goes your $2,500.
Sorry.
Thank you, Ms. Lancaster. I'd certainly favor it. Let's ask the rest of the council. Does anyone have any objections to it? Ms. Drake?
I don't. As long as,
It's just a very short time, but maybe it would help.
Mr. Frierson?
No.
Dr. Grossnickel?
It'll be fine.
Mr. Jenkins?
I'm okay with it.
Mr. Wright?
No problem.
Please make the motion.
I make the motion that we suspend the fees from the time the ice storm through the end of the month.
That should be more than satisfactory.
I'll second
Is that
it.
too long? John? what do you
No, I
think?
think that's great.
Okay.
I'll second it. All in favor?
Aye.
Anyone opposed? No.
Sorry, Gene.
Mr. Wright.
Sorry, Gene.
I don't want to disappoint anybody, but the fire chief and I suggest that, especially since we have an executive session still to go, that the fire chief's presentation can wait for 2 more weeks.
Oh my God, you scored good points today.
I make a motion, we table number 21,
Okay,
the
so
presentation,
I'll
till
second
the
it.
next time.
All in favor?
Aye.
All right. All right. Item number 24, convene into executive session pursuant to section 551.071 of the Texas Government Code, consultation with attorney to receive legal advice from city attorney about pending or contemplated litigation or on matters in which the duty of an attorney to his client under Texas disciplinary rules of professional conduct of State Bar of Texas clearly conflict with this chapter as follows. Ali Joe Burris versus Veronica Blake, Bobby Joe Hundley Jr. and John Doe, cause number 83035. Number 2 is pursuant to section, excuse me please, it's too loud. Pursuant to section 551.087 of the Texas Government Code to discuss or deliberate regarding commercial or financial information that the governmental body has received from a business prospect that the government body seeks to have locate, stay or expand in or near territory of government body and with which the government body is conducting economic development negotiations or to deliberate the offer of financial or other incentive to a business prospect described by subdivision 1. The time now is 8:06 p.m. and the council will go into executive session. Oh, I'm sorry. The time is now 7:40 p.m. The time is 8:05 p.m. Here we are back out of the executive session. The council was briefed by the city attorney on the pending lawsuit. Item number, I said the time, right? 8:05.
Yes.
Item number 25, reconvene into open session, so we're back into open session. Item number 26, consider and approve future events for the city council on the city staff pursuant to resolution 2004-081. Anyone has any comments on this? No? No one? Was there a football game tonight?
Not tonight.
Oh.
No, not tonight.
All right, Mr. Frierson.
Second.
All in favor? The meeting is adjourned. Sorry to keep you waiting.